Welcome to Sidelined, your dose of analysis on the biggest injuries and conditions affecting sports today. Featuring insights from the doctors of Palm Beach Health Network Physician Group in partnership with ESPN WestPalm. Now, here's your host, David DePino.
Thank you for joining the Sidelined Podcast. We're here with Dr. Anthony Giuffrida. He's board certified and fellowship trained in interventional spine and pain management and specializes in sports medicine, physical medicine, and rehabilitation at the Cantor Spine Center at the Paley Orthopedic and Spine Institute in West Palm Beach and Fort Lauderdale. Welcome to the Sidelined Podcast, and thank you for joining us today.
Thank you very much. Happy to be here.
MLB.com recently reported that New York Yankees pitcher Carlos Rodon is expected to receive a cortisone injection for a troublesome lower back, keeping him on the injured list. Dr. Giuffrida, how do pain management injections work to help with back ailments?
So this is a great question. A lot of us have back pain out there, and a lot of athletes get back pain. Basically, how an injection works is there's corticosteroids in there or an anti-inflammatory, and there's some numbing medication in there, either lidocaine or Marcaine. Everyone knows about Novocaine when you go to the dentist. But what it does is it numbs up the nerve that's very irritated, but the most important part is the steroids that help decrease the inflammation, usually from a disc herniation or a disc bulge or some inflammation from the surrounding facet joints. If you're able to clear out that inflammation, a lot of the pain will go away. The pain is caused by an irritated nerve, and if you can calm down that nerve, calm down the inflammation, you're usually able to get rid of that pain and get that patient or that athlete back to feeling well.
What other types of treatments do you offer for lower back pain?
So there's a lot of lower back pain ailments out there. We have facet joint disease, we have stenosis, we have sciatica, we have disc problems. So we can basically treat any of these areas with anti-inflammatories if inflammation is the issue. If it's a compression, then we have to go in and decompress the area, decompress the nerves, decompress the spinal cord. We have a lot of minimally invasive techniques out there to do this. We have one called the mild procedure, which helps decompress the spinal cord for lumbar stenosis. We have one called the Disc FX procedure. That's just a fancy way of doing a microdiscectomy through a very small tube. We have one called the Reactivate procedure that helps stabilize the back. We have one called the Intercept procedure that helps kill the nerves that are causing the pain in the back. The goal, though, is always to do the least invasive procedure, having the most maximal effort or most maximal output for the patient. And in the world of interventional spine right now, it is growing gangbusters for minimally invasive. Things are getting smaller and better, which is just better for the patient. Because I always tell my fellows and my residents, you want to be able to treat the problem without causing any destruction. And I always tell people, doing a needle injection causes pain. We don't want to cause that pain. We can't get the medicine to the right spot without the needle. Well, we want to do the least amount of damage when we're fixing a problem. So it's a very exciting field to be in. It's really growing leaps and bounds year over year. And I think in 5 to 10 years, it's going to take over the spine space and be able to do a lot of minimally invasive things, get people back up and running without causing a lot of destruction.
That's great. Neck injuries are common in college and pro football as well as other sports. If an athlete, weekend warrior, or even any other adult, as someone maybe suffered from whiplash from a car accident, how can you provide non-surgical pain management for neck pain?
So neck pain usually is caused from the joints in the neck, the facet joints in the neck. I always tell people your head is like a bowling ball. And when you get something like whiplash or a muscle spasm, it's hard to hold up that bowling ball. It'd be like if you're trying to hold out a bowling ball with your arm for 5-10 minutes. Yeah, you could do it, but you try to do that for a half hour, your elbow is really going to start to hurt. Well, that's just one joint. Your neck has 7 or 8 joints in there that are going to start to hurt. And each of those joints has 3 components to it, 2 facet joints and a disc. Well, you do that for 60 to 70 years, you start to have some inflammation there, some arthritis. So what we try to do is decrease the inflammation, decrease the arthritis. The number one thing you should do, though, is first maybe connect with a physical therapist. Try to strengthen the muscles around it. If you strengthen the muscles around these joints, your trap, your rhomboids, then your other paraspinals in there, you'll be able to take some of the compression off the disc in the neck, off the facet joints in the neck. And then if we have to, we do something like an epidural facet joint injection or even an ablation in the neck to help decrease the nerve pain, which will in turn decrease the pain and hopefully get your muscles back to stabilizing the area.
Great options for neck care there. In the NFL, former Dallas Cowboys wide receiver and Super Bowl champion and Hall of Famer Michael Irvin has talked about a condition he suffered late in his career, spinal stenosis. Just a few years ago, another Dallas Cowboy linebacker, Leighton Vander Esch, also reportedly had a neck injury and was diagnosed with spinal stenosis. Dr. Giuffrida, what is spinal stenosis, and is there a non-surgical treatment option you specialize in for spinal stenosis care?
So there's cervical, which is neck, and there's lumbar, which is lower back spinal stenosis. I believe Michael Irvin, he had cervical spinal stenosis, and what we try to do with that non-surgical would be doing some epidurals to try to calm it down. The problem with spinal stenosis, though, a lot is it's like a pipe in your plumbing system. If the calcium builds up around it, sometimes you have to do a roto-rooter. That's where I use my partner, Dr. Jeffrey Cantor. We have a very minimally invasive technique where he goes in and actually just opens up the pipe from the inside out. Instead of taking the pipe totally out and building a new pipe, he can kind of go inside around the spinal cord while being inside the cervical canal there and core out all that inflammation, all that stenosis that's causing the compression. With lumbar stenosis, a lot of times it's caused from extra ligament. That ligament, we have interventional spine techniques where we can go in and just core out some of that ligament with something called the mild procedure, or we can open up a little bit with some little minimally invasive procedures such as the Minuteman procedure, where you can actually go in and kind of jack up the area so that the ligament doesn't fold on itself anymore and push on the spinal cord. So depending on the area, there's different treatments for it, but at the Cantor Spine Center and Paley Institute, if you're going to need spinal surgery for stenosis, there are ways to do it right and there's ways to do it wrong. And the old-fashioned way of doing it, of taking the whole pipe out and replacing with screws or rods, can really cause some problem in the long term. So you kind of want to keep as much of the natural structure intact as you can.
Besides neck joint pain and back joint pain, you also specialize in other types of joint pain. How can you use interventional pain management for joint pain relief in the elbow, shoulder, knee, hip, etc.?
Joint pain throughout the whole body is very similar in how it occurs. Usually you have some microtrauma, either a tear, cartilage defect, or just some inflammation in general can get into that area. A bone spur usually cause a lot of inflammation. So the number one goal is to first decrease the inflammation, and then second, try to heal or protect the tear. We do steroid injections in the joints a lot, but actually those can hurt the chondrocytes in there or hurt some of the bone inside the joint. So we don't like to do a lot of steroid injections into each joint. What we'll do is something called a PRP injection, or a platelet-rich plasma injection, where we take off the good healing cells from your blood, and we can inject them into joints or tendons around these joints that can help actually heal and tighten up some of those areas without causing any problems. The thing I love about PRP, I tell everyone there's no side effects. It's your blood. I'm just taking the good healing parts from your blood and putting in an area where the blood doesn't get to. And it's able to heal those areas now that blood supply doesn't get to most of the time. With that, your body can kind of try to heal itself.
No side effects is a great option.
Yeah.
Plantar fasciitis, an injury of the heel and foot, and treatment regularly trends in pro sports, namely in the NBA, with reports of famous basketball stars like Philadelphia 76ers center Joel Embiid missing time last year. That was a big injury for him. And Portland Trailblazers guard Damian Lillard battling the ailment early in his career. What is plantar fasciitis?
Plantar fasciitis is one of the tougher things to treat. Basically, you have something called the plantar fascia in your foot. And the pain, that fascia connects to the bottom of your heel, right in the middle of the bottom of your heel. And that's where that pain point will be, right? It's really some inflammation of that fascia that's attaching right to the heel bone there. It can be very painful because every time you take a step, it hurts. If you have a bad shoulder, it hurts when you move the shoulder. You know, you can't just stay off your feet all the time. Especially for athletes, they're not just taking steps onto their feet, they're putting pressure to their feet by jumping or running. And it's hard to treat because the best way to treat it is to rest it. But you'd have to rest it for about a month for it to totally go away without any other treatment. Therefore, physical therapy is one of the best things. Ice the heck out of it. Anti-inflammatory injections help out a lot. And once again, we talk about PRP. PRP helps out a lot with plantar fasciitis. In the end, though, a lot of times the player will just have to take a few weeks off, try to allow that to heal, allow that bone spur maybe that's causing the issue to decrease in inflammation, decrease in pain.
Is plantar fasciitis just common in athletes, or can it affect, weekend warriors or, general adult population?
Yeah, it can affect anyone. Basically, if you're on your feet a lot, you can get some irritation in that area. One of the best things you can do is make sure you have good sneakers on, good footwear on. I see it a lot in people that wear high heels a lot. It's putting a lot of pressure right into that heel joint. You want to have good sneakers that disperses the area, especially if you're going to go out for a run, if you're going to work in the yard. If you're in the hospital, all our nurses and docs and everyone working on their feet all day want to have good footwear on. That's going to help disperse the pressure in your foot to the whole foot instead of just right through the heel, which one is putting much pressure on that fascia, that plantar fascia that's connecting right at the heel.
And how do you provide care for plantar fasciitis when it's, an ailment that people just can't get rid of? Is there a non-surgical pain management approach to this condition?
100%. So injections do very well. Steroid injections there help decrease the inflammation, and PRP injections help out a lot. Other than that, surgery, if you have to go in and kind of shave off a bone spur sometimes, if there's a little hook on the heel and the fascia is rubbing over it, you can imagine how that just keeps causing tearing and keeps causing injury. Sometimes they can go in very minimally invasive and just shave off that little piece there. We actually have a great surgeon in our group, Dr. Bradley Lamb, that can do that procedure for you. Really high likelihood of it going away with minimal rehab.
Tendonitis inflammation can develop over time in any of the body's tendon. Can you explain what tendonitis is and treatment options you care for this nagging condition?
Yeah, so tendonitis breaks down Latin to inflammation of the tendon. And tendonitis, inflammation of the tendon, usually occurs from overuse. Pitchers get it in their elbows, shoulders, all over, right? Because overhead use, repetitive overhead use from a pitcher. Quarterbacks will get it in their elbow a lot. We see that a lot. Number one treatment for tendonitis in the Weekend Warrior, ice, Advil, and rest. Ice the heck out of it. Ice is your best friend for tendonitis in a superficial joint, your knee, your elbow, your shoulder. After that, if you do need it, we can do some minimally invasive injections that can help out. And then also there's some debridement techniques where we can go in with a little water jet actually and kind of clean out some of the scar tissue that allows the healthy, good tissue to heal a little bit better. And once again, we have a PRP option as well in tendonitis. PRP does very, very well in tendonitis. One of the reasons tendonitis is so nagging is, once again, it doesn't have much blood supply there, so it takes a long time to heal. If we do a PRP injection, it's really taking the blood supply from a different part of the body, those good healing properties, and putting them to another area.
Can you also share with us your education and training, including completing an interventional sport and spine fellowship with Dr. James Andrews, a world-renowned orthopedic surgeon who ESPN often refers to? I know it's been public that he's treated many pro athletes. What was it like studying there, and if you could share the rest of your education and training?
Yeah, that's great. So I have to give kudos to Dr. Bradley Goodman. That's who did my interventional spine portion of the fellowship. But I was lucky enough to work every Thursday at the Andrews Institute. We did all of their non-surgical interventions. They had a sports medicine doctor there as well, but we did most of their non-surgical spine stuff. And I really got to learn a lot. It was interesting to be around athletes almost nonstop there. And unfortunately, Dr. James Andrews, I was in Birmingham. He was in Pensacola a lot, so I only got to meet him two or three times. But some of the guys we worked there, Dr. Lyle Kane or Jeffrey Dugas, really good guys. We were able to take care of a lot of their non-surgical stuff. But it really, we saw a lot of college athletes, a lot of high school athletes, and even some pro athletes. But it was eye-opening just to see how many techniques Dr. Andrews came up with. I mean, he's the number one guy in treating Tommy John, let's say, or doing ACL repairs. Him and his team, the way they would get these guys back on the field is amazing. Just the way they thought about athletes and they thought about different sports injuries. And the funny thing, people always said, you're seeing what, 90% athletes? Like, no, at the Andrews Institute, it's only about 5% athletes. You're still seeing their general population in Birmingham and taking care of them as well. But it always was really eye-opening to go to the Institute. I was lucky enough, actually, Dr. Charles Carnell is who I worked with there. He was part of with Dr. Goodman, and I was able to join some of their journal clubs and do everything there. It was a very eye-opening experience, and as a big sports fan, you walk in and you see jerseys signed by every athlete you've ever heard of, and it's not just signed, it's like a paragraph. Dr. Andrews, thank you so much for helping me. You were the best. I mean, it's a lot of fun to see these players and everyone get better because of techniques that he developed and are being passed down throughout the Institute.
Great info there on interventional spine and pain management, sports medicine, physical medicine. Dr. Giuffrida, thank you for joining us on the Sideline Podcast. This has been great info.
Thanks for having me.
For more information on Dr. Anthony Giuffrida, interventional spine and pain management, visit thepaleyinstitute.org, or call the Paley Orthopedic and Spine Institute at 561-446-0645.